that's a good theme, because here in Brazil we have strict criteria that we have to follow. So it's a little bit different from many other countries. So here, if you go strictly by the law, you can only transplant within the Milan criteria, okay? But individual patients can choose to perform living donor liver transplantation outside Milan. But in that case, they will not be able to perform a retransplant with a deceased donor if anything happens in the post-transplant period. So the patient has to understand that criteria to accept a living donor here in Brazil. But as I stated in the paper, it's my personal point of view that any patient that can be transplanted as deceased or living donor should follow the same criteria. What we are doing right now is that we are establishing different criteria for living donor or deceased donor in HCC patients. So if we could improve our selection criteria, we could perform both of the modalities. If the patient has a suitable live donor, he can be transplanted with a living donor, and let the patients that do not have or cannot be transplanted with a living donor for the transplant list. So